Welcome back to MedFluencers Unscripted. My name is Dr. Adam Goodcoff. We are excited to welcome you to the show. Of course, I am joined by...
Hi guys, Jordan Litherland.
And today we're going to be meeting the Spitfire nurse, M. Now, Shone is a phenomenal nurse creator, advocate across social media on a host of topics. She's based in Houston, Texas, a breast oncology nurse, though recently from palliative care. Is that right, Jordan?
Yeah. So she has a unique lens. I would say that's not probably one of the most glamorous fields of medicine, and she really brings a unique perspective that would make you feel differently, like that she's the lucky one to do that work. So really cool to talk with her. She also got very honest and vulnerable into her mental health journey. I think this is such an important conversation that needs to be talked about more, how she's using her platform to help people. So I think a lot of people are going to like this conversation today.
We covered a lot, so stick around. We're going to get into it shortly. All right. So, M, obviously you have an interesting background. Everyone that comes on the show has a very interesting background. Tell us how you got here. What drew you towards palliative care?
So my mom is in social work, and she does she loves palliative care as well. But I actually got started in it. I worked in the emergency room as a research assistant after undergrad, and there was a palliative care physician that I was working with, and I did a research project with him. And he kind of ignited that flame that was already there. And then as I was going, I decided originally I wanted to go to med school, and then I decided to go to nursing school. And I went into oncology, mostly because I thought it was not going to, I wasn't ready for oncology. I don't know, it's a difficult field. But I really liked that oncology and palliative care run hand in hand. And the floor I actually worked on, both services ran at the same time. So at any given day, you can have a palliative care patient, an onco palliative care patient, or, oncology, just an oncology patient. So that really got me going. And then as I went throughout the rest of my career and I picked oncology, there was a role at MD Anderson where I work now. That was onco palliative care. That's just pure onco palliative care. And I was like, let me do this. And it's amazing. These patients are, really, really sick and really struggling, and to be able to help them, get through some of the toughest points of their life is amazing. It's a tough field, right? These patients are not doing well. It's a lot of death and dying or almost death and dying, but
sure.
I honestly love it. I think people find it weird that I love palliative care. They're like, oh, that's so depressing. I'm like, it's not though. It's meaningful to help patients find comfort towards the end. So
I think it gives you a chance to be there for people when they need you most, right? Maybe it's not always from a medical care side. I'm curious why specifically nursing. Out of all the careers out there, lots of ways to help people. What made you want to do nursing? Was it something you've always wanted?
So since I was in 6th grade, I knew I wanted to go into healthcare. I wanted to be a doctor. I thought I wanted to be a trauma surgeon because I watched all these bloody and gory movies, and I was like, I want to do that. That sounds so fun. So I was when I was in undergrad or high school, I was like, okay, let me prepare for med school. I went to undergrad, and I was pre-med in undergrad. And all the while, my dad, in the background, was like, do you really want to be a doctor? Why don't you consider nursing or being being a PA? And I was like, no, I want to be a doctor. I want to be a surgeon. This is what I want to do. And then again, in the emergency room is when I realized, number one, I could never do trauma or emergency. That is way too tough for me. And number two, I realized that I really wanted to be with patients, a lot of time with patients. And that's really why I wanted to be in healthcare, because I wanted to help people. And my dad, again, finally asked me the question. He was like, Emily, can you tell me why you want to be a doctor versus a nurse? And I couldn't give him a good enough answer. And he was like, do you really want to put yourself through med school knowing that this is not something that, you're going to always be questioning something? And that was kind of an eye opener for me. But again, working in the ER, working with the nurses there, they're, amazing. And helped me decide that nursing was my path. And it was a really odd kind of feeling, because the day I picked nursing, it was literally I felt like the heavens were like, this is your career path. And I have not looked back, and I love what I do now.
And I would imagine kind of some of the responsibilities you had in the palliative care interaction with patients has translated well into the oncology side as well. There was a lot of skills you could take with you.
Yeah, I always joke that I am the only, I'm not good at nursing skills. Like if you ask me to put an IV or anything like that, I'm not good, but I am very good at talking to patients. That's my favorite part of nursing. And I think in oncology and especially with palliative care, that's what you do. You talk to patients, you make them, you hear their stories, help them through some of the struggles that they're dealing with. And I think a lot of the time, in especially in palliative care, it's a lot of the emotional aspects of cancer that often get, I don't want to say neglected, but, when you're seeing 30 patients in clinic, as an oncology nurse or as an oncology physician, oncologist, it's hard to address those aspects. So palliative care is where we kind of, we're allowed to do that. We're permitted enough time to do that. And it's helpful for patients because they're finally like able to confront some of these mental health issues that they've been kind of suppressing throughout.
And tell me if I'm wrong, but we've talked about this a few times on the podcast. A lot of these tools to interact with the patients, the emotional, mental side of it, they're not always giving you these tools in your training. So like this, where I think is where you have that gift and it just comes naturally to you.
Yeah, I mean, it started when I worked in the oncology floor. I used to get in trouble with time management because I would just sit there and talk to patients. They'd be like, why is it taking you as a student, right? Like, why is it taking you an hour to do a med pass? And I was like, oh, because they're just telling me about their life. Like, that's what I like, right?
Yeah.
These patients are going through tough times, and for them to sit down and just have a conversation, and to distract themselves from the fact that, they're going through treatment or, they have to, go through like a life-changing surgery. That's what's really valuable to me, and be able to provide an opportunity for these patients to open up.
But I know as a patient, I appreciate that because you hate that feeling when you're just like another number and you're in and out and you feel like they didn't even listen to you. So, I mean, that is amazing that you're making people feel that way.
I love it. It's 100% the best part of nursing. 100% the most valuable part of my career. I have learned so much like life advice from my patients, and even through my own mental health like struggles, like my patients have helped me because they've helped me realize that the value of life and that things can change at the drop of a hat, right? You can get diagnosed with cancer for no fault of your own, like the next day, right? Just based on either genetics or just like drawing a bad hand in life, right? So they've helped me really stay in the present, and that's helped me keep me focused and keep me grounded.
And why is it important for nurses to be in the mix on social media? Why do you spend your time doing that?
I think because everyone, well, a lot of patients nowadays are getting the majority of their information from social. And I know as MedFluencers, it's our role to not only provide, medical information, but also combat the misinformation that's out there. And as a nurse, like we see that all the time. And I think because of that relationship that we have, as nurses with patients, and, we spend a lot of time with them, it's important for me to get out there and, educate patients and also inspire and encourage other nurses to speak out, and have a presence on there because, that's again, where people are getting the majority of their information from.
And are you getting information from social, from your peers, staying up to date with the latest trials and all of advancements in that realm?
Oh, absolutely. I mean, I follow up. I think it's irresponsible not to do that. I don't like reading, to be perfectly honest, but I do, I follow so many amazing oncologists, and, palliative care physicians that are always, that's why I learn, and that's where, patients will bring it up too, because they'll be like, oh yeah, I heard that this doctor said this, right? And like, what do you think about that? And I'm like, that's cool that, people are taking all this information that they get from social and bringing it in, and, being able to talk about it and be like, yeah, I saw that same thing too. So
I think there's a nice ecosystem that you're referencing here where, you're learning from others. There's what we'd call peer-to-peer communication happening. There's patients listening in. There's you having a connection with your audience, which is not patient care, but it's kind of giving, what I'm hearing, it's like a similar sense of joy, this ability to connect with people, right? And then it all ties back together where you're hearing patients talk about the clinicians that you are then friends with and connect with on social. So it's actually this big network, which I always love hearing. It's how I felt for years, but it's great to hear also you speak about, advocating for other nurses to be there. What were some challenges that you had to overcome? What was it like getting onto social media as a nurse for you?
I think the biggest thing was putting myself out there. I'm pretty outgoing and like bubbly now, but I didn't used to be that way. I used to be pretty introverted, and I think, putting myself out there and, not emotionally, it was tough, right?
Yeah.
You have to have thick skin to be on social media, and I thought I did, and I realized I don't have as thick skin as I thought I did. But being in oncology is, it's not a flashy field. A lot of social media nurses that are really popular are either in ICU, ER, aesthetics, stuff like that. It's really that field was small. So when I first started, my growth was small too, and I was getting discouraged about that. But then patients, or people would just attack you. Especially being in oncology, people nowadays now are, they're like, you're, you know, um, pushing poison, all this stuff. And it's tough. Like, and I honestly, I internalize all my, so bad, but I internalize all the negative comments. I remember every negative comment that I've ever received on social.
Wow.
Those are the ones that stick out to me. But it's few and far in between. But I think that's the hardest part, is just kind of trying to shrug off the negativity while also embracing all the positive sides. So
I would actually, for words of encouragement and true like support, you mentioned maybe there's more exciting like derm and plastics. Like we don't need more derm and plastics. Sorry to say that to the derm and plastics out there. Like that exists, right? And that's a very like vain industry. We could use some more educational folks getting on talking about skin cancer and screening exams, right? But what you're doing, and I think what you should take pride in, is really connecting with an audience that in a way is marginalized, like you've described. Like this is not the glitzy, nobody's coming on to really talk about the struggles of going through the oncology pathway and experience. And I think what you're doing and humanizing that and sharing your experience is actually incredibly valuable. And I hear you, I've been on social for a while, there's definitely some negative comments out there. But I think you're paving the way for other nurses, for other clinicians to get on there. And in some of these specialty areas that maybe feel like, well, it's not, I'm not doing, injections, so I shouldn't be on social like that. I think we're far away from that now. We're really in a space where it's open to education and communication. And applaud you for the openness to put yourself out there.
Oh, thank you. That actually is coming at a great time. I had to take a little break from social media because I was just getting so in my head about things. And so I do appreciate you saying that, because it's helpful to know that, the stuff that I'm doing is actually making a difference.
Yeah. And absolutely. I think with you too, obviously you're educating for the patients, but then giving support to the family and friends that are going through this journey with the patient. So that's also really cool too, that you're a resource for them.
Yeah, it takes a village with the cancer, with cancer. I always tell my patients, it's not a solo disease, and the people that have, networks of support systems always do better than those that don't. So even if it's just me supporting the patient, and we do have patients like that. It's so sad, because we take it for granted. People are like, oh yeah, do you not have like a spouse or like friends and family that can take you to and from your appointments, or, help you through, your treatments at home. So to be able to be there for patients, and their families who are also struggling, just as much, but may not want to say it just because they feel, that they're taking away from the patients themselves. So, yeah.
I'd love to talk about the mental health aspect, and we've kind of danced around that right now with social, and it's very real, right? The impact of social media on mental health, the doom scroll, if you will, and the things that, especially as a creator, then you have to deal with the comments and, the performance anxiety of something. I keep making content and no one's watching. And so there's an element with social media that we can talk about. I'd also love to hear from your perspective, working in oncology and the toll that takes on your emotions, your person, your psyche. Like, tell us about that.
So oddly enough, when I actually love my job in oncology, I don't think it's a depressing field. Like everyone says, oh, you work in oncology, it's so sad. And honestly, that changed. Like it all started when I was a student, precepting in my final semester, and my preceptor pulled me aside like the first week I was there. And she said, and like, we're working in a, very tough field, and you're going to see a lot of death and dying, with cancer. And she said that, for a lot of these patients, death is a release of suffering and of pain, and of struggles they've been dealing with since the time of diagnosis. Many, sometimes can be years that they've been dealing with this. And that simple, like, it was literally just like that conversation. It was like a 2-minute conversation. Wow. It shifted my entire perspective. Mm-hmm. Wow. And now, like, even, it helped me in palliative care too, right? We help patients embrace the inevitable, but embrace it in a way that gives them back some control over a disease that, has ravaged their life. So I think in that aspect, it's helped definitely with my mental health. Sure. And I also, I've had coping mechanisms that I initiated at the beginning as well. When I'm there, when I clock in, I'm 100% there for my patients. Like, I will be there, but when I clock out, I'm out.
That's what I was going to ask, how you compartmentalize it. That is what, like, I don't know how you do that.
It's always been, I've been a compartmentalizer my whole life. But it really, and I wanted to pick a career that I could do that, right? That I could leave work at work and just go home, and with my best friend who I used to live with, she was also, she's a pediatric oncology nurse. We would allow ourselves, maybe 30 minutes at home to discuss work. And after that, nothing else. Sure. Right? We don't talk. The house is a safe space for me. Like, my husband knows, like, he's like, how's work? It was good. That's it. Right. Yep. On the way home, I used to have a longer commute, but on my drive home, and I'll call and, like, maybe we'll talk about it then. But the moment I enter my house, that's it. And that keeps my peace and keeps my sanity.
I like that. My fiance's in medicine also, and we don't talk about medicine a ton in the house. Occasionally, same thing. There's a particularly troublesome case, something just doesn't make sense. We'll bounce it off each other, but it's not a common conversation. I think we both like to leave it at work.
Yeah, I mean, it's tough. Like, you don't, especially if you're married, or you're married dating someone in medicine. That's your whole life. So to have a time in your day where you don't have to devote to medicine, to your job is really important.
Yeah. So I'm curious, because you've had your own mental health journey where you've had trials and tribulations there, and you've been very open about it on social. We just talked about being vulnerable. So I'm sure that gave the keyboard warrior something else to be in your DMs about. Talk about that, why you wanted to be honest on social about that.
Mental health for me, is a journey, like it is for everyone, right? And I hit a very, very, very low point in my life where, I almost ended my life. And I have come such a long way from that point. And I know that my story is not unique, right? Everyone hits that point in their life. And working in healthcare, depression and anxiety are running rampant, right? Because we are dealing with very difficult situations, patients at the worst. And I think people in healthcare, nurses especially, we will literally work ourselves to the bone before we even address the fact that we're struggling internally as well. So the reason I'm open about it is because I want people to know that, that these feelings that we're having are very real and need to be addressed. And also it's okay to have them. Yeah. Right. I think in healthcare, we tend to, self-care is not, we talk about self-care all the time, right? Because it's super important when we can't pour from an empty cup. But I think people are ashamed, to admit that their job is causing them anxiety or, depression. And for me to share my story and hope that it helps even one person, that's good enough for me. So
it's interesting you say that. We had recently an Instagram live. Yes. Dr. J. Max Slaughter was on there talking about Lorna Bream Foundation and mental health in medicine. And obviously, it's different at all levels, but for physicians, for your license, there is a box that says, have you ever had a struggle with mental health, or have you ever seen anyone for mental health, which is insane because you're told to take care of yourself. We know we need to take care of ourselves. We know this is an insanely stressful job, but then we're told, if you put this down, you might not get your license in this state. And so there's a lot of great folks doing work on how to push that needle forward, but it is such a old mentality, and unfortunately very harmful mentality. I like what you said. Everybody has their own journey through mental health, and everybody is, having different parts or levels of that journey. And medicine has I don't know if you felt this, kind of like a sense of guilt, like when you're like, well, I don't feel right, but these people are really sick and I'm here to take care of them. So how could I not feel right? Like, imagine and I can only imagine how, serious that is in oncology, right? It's like, this person has freaking cancer. Like, so my problems don't matter. I need to swallow that, and I think a lot of clinicians, at least that I hear, when it gets to the topic of mental health, feel that they're like, well, I got to be thankful, at least I'm not in this situation, and that's a Band-Aid to a problem that are really two separate things. Like, it's okay to not be okay.
Yeah. It's funny, you mentioned that, because I always tell my patients, your journey, you never compare yourself, your journey to someone else's, right? Your suffering is not the same as someone else, right? And I think in healthcare, we need to do that as well. Comparing our, the way we feel to the way patients feel, and, trying to be like, underestimate, how the power of, of mental health and the impact that it has on our ability to do our job and our ability to care for others, is dangerous. So I not Jake Goodman, like, I've been following him for years, and, he's such a strong mental health advocate. And I really resonate with a lot of the words that he says, and he's been very open about his mental health journey. And I think, he kind of inspired me to share my own. I know I've been following him since, I had my low point in my life. So I think, I took a page from his book and was like, nurses must be, feeling like this as well. And I do follow a lot of other nurses who are very open about their mental health journey. I think that's becoming more common nowadays, because it is, I don't know anyone who works in healthcare that doesn't have anxiety.
Yeah.
This is a very anxiety, like, provoking job, right? We're taking care of people at their worst. So, hiding it, and it's not,
Have you met Dr. Goodman yet, or virtually?
I have not.
Okay.
I've met him.
Make that happen.
I've spoken to him quite a lot, but he's
we should have surprise guested that, Jordan. We'll make that happen. I think that maybe could be like the next Instagram live. We'll bring Em and Jake on one together, because you guys would make a dynamic duo for a chat, and it'd be good to see. So maybe we'll put that on the back burner.
Yeah.
Oh my God, I would love that. Yeah, he's been a huge an idol of mine. So
he's great. Makes really good content. I always like to ask, you've been on social media for some time now. You have a feel for what the platform is, and obviously changing space right now. But where do you think we're going to be in 3 to 5 years on social? Are you still going to be here making content?
Yes, 100%. I'm still going to be here. I don't know, again, like, where we're going to be as a country, in terms of social media. Who knows?
Sure.
But no, I think there's going to be a bigger presence, right? But I think in these next 4 years, I think the people, like MedFluencers and people who are actually, have legitimate medical degrees and are coming from legitimate healthcare backgrounds, we have a lot of work to do.
Yeah.
And it's very, I'm looking at this mountain of that we're going to have to overcome, and I'm ready for it. Right. There's going to be a lot, and it's already happening. Right.
Yeah.
Ivermectin in oncology. Right. I've had many patients ask about that.
Really?
And that's just the beginning. So I think there's going to be a lot more, interesting discord going on in the next couple of years.
Sure.
But I think, we need to buckle down here and, really do our best to combat the misinformation and protect our patients from advice that could potentially harm them.
Do you think, we don't typically get too far down this rabbit hole, but do you think other nurses are looking to nurses on social media for education?
Like education, just
education, like
clarify.
from a healthcare, right? Like from a healthcare lens. So if I'm an oncology nurse, and maybe now, I'm making content and there's an ER nurse and they're watching, do you think they're open to learning and say, oh, this is interesting, I didn't know this about the specialty? Or do you think it's still kind of more of like, that's really more for fun and kind of entertaining? Where does that line sit in your experience?
No, I think it is, there is a lot of education and there are people out there, and I know because I have had quite a few nurses reach out to me about
Mm.
oncology nursing. And I think it's because in nursing, nursing school is kind of, and I did an accelerated program, especially, it's kind of very focused. They cover, the basics, right? Med
Mm-hmm.
surge, labor and delivery, some ER, but there's some specialties that are definitely not highlighted as much, and oncology is one of them. I'm pretty positive. Like I
Yeah.
know, like when they in my nursing program, they said oncology nurses give chemotherapy. That was it, and I was
Mm.
Wow.
like,
There's
and
a
I was
lot
like,
more
there's
than that.
so much
Yeah.
more.
Yeah.
And oncology is one of those fields where it's like so massive, and you can do so much within
Hmm.
it. So, yeah, 100%. I think that people are, educating not just the like um, patients, but also other nurses about, about their specialties and talk, offering, the direct contact communication. Like if you're interested in this, please reach out to me. I'm happy to,
Right.
talk to you about it more and give you, opportunities, or talk about the opportunities that are available within the specialty.
And that's got to be rewarding too, to feel like you're kind of helping and paving the way for the next generation of healthcare professionals too.
Oh, absolutely. And like, oncology nurses, like we are a special group, and the more we have, the better. And I'm always happy. I'm like, yay, like you're going to pick this specialty. It's going to be awesome. Like you're going to love it, or you're going to love it or hate it. But I was like, you're going to love it. It's going to be life changing. And you're not going to want to do anything else. But that's just my slightly biased opinion.
It's funny on social, and I see it less now, but when social media started, there was this feeling of like, well, I hope there's not a lot of other ER doctors because I won't have a shot to really grow an
Mhm.
audience. And I think we're seeing time and time again that that's wrong. ER has been one of my favorite places to watch grow because the amount of ER creators has grown exponentially, and it's only made the space better. And what we find is just like in real life, everyone has a different personality, everyone has a different area of interest or topic that they want to discuss, and we see that on social. So I think it's great, especially as we see the nursing space continue to develop. And again, nurses have been on social. I don't want to imply that they are not there, but it is another actively growing kind of segment, and especially in these subspecialty areas where, like you said, there's not a lot of education on nurse oncology. And frankly, like in medicine, I mean, yeah, we know the basics, but oncology has gotten so far down the line. We spoke with a guest a few weeks back, and I had tons of questions because I'm like, this didn't even exist when I was in med school, and that wasn't that long ago, But these treatments weren't even around. So the pace at which medicine is evolving, therapies, right, the medications that we can give, the devices that exist, it's evolving so quickly that it's almost becoming this really fast way to disseminate information amongst peers, which is great.
Yeah, there's a community aspect too about that social media that I love. Like, I've met so many amazing creators and providers and other nurses on social media, and it's nice to know that there are people that will back you up, and be like, yeah, like I saw this, like Dr. Eric singing, like we're really good friends. We
Yeah.
work together in real life,
Mm-hmm.
and it's nice to know we create content together, and I think it resonates with patients because they're like, oh yeah, like these two oncologist and an oncology nurse like working together to combat misinformation and also educate patients in an entertaining way.
I think it's interesting, and I'll just touch on it briefly so we don't get into a hot topic. But you mentioned, that you guys work together, you have a shared workplace. I think, right, one of my, if you were asking me in 3 years, where I think like that we can have huge development is safety or security around content in the workplace. Not with
Mhm.
patients. I'm not going rogue and saying we should be like TikToking on an IV pole past the patient rooms, right? That's like the wrong arm. But there are so many incredible leaders at all training levels within the health system that I think watch content and say, man, I'd love to do that, but there's no way my hospital would ever let me do that, right? Or I would get fired immediately, or they might say yes to this, but who knows? And so I think that we're seeing it actually, more this year, an appetite from health systems reaching out to us at MedFluencers saying, could you help train HCPs to do this stuff? Could you help us set the standard of what's appropriate? But I think that is a big step forward in terms of supporting HCPs. There's, as you mentioned, there's an element of community on social. There's an element of kind of blowing off some steam and getting to, share interests, share hobbies, create this content and online digital footprint persona that you want to be. And so that's something that I'm really excited and watching here kind of in the coming years is like, where does that support come from? And so you can dodge the question, which is at the end of this long-winded, which is how do you balance working at a large institution and making content on social media? And if you want to pass, you can just hold up the imaginary pass card. I won't fault you for that either.
Oddly enough, we just had a social media meeting at my job.
Okay.
And it was interesting. I think, my institution is big in social media right now. But it's tough, right? Because I'm working as a travel nurse. I have experience. I've gotten reported before.
Sure.
For not even like filming on campus or whatever, just because patients, they're like, "What is this? What is she doing?" Like blah blah blah, right?
Right.
So I think it's interesting. It's tough. But just making disclaimers and making sure like that this is the content that I create at home. I don't have anything branded from my institution. And making it very clear that this is my opinions are my own, and I also have to be a little bit cautious about what I say in general, because patients do bring it up, right? And they might report it or whatever. In this day and age, like people are getting reported to the board of nursing, their respective regulatory boards. And that's really scary for me. Like, I work really hard for my license, and, a lot of the content I create is very benign, but who knows, like a patient take it the wrong way. And all of a sudden, like I get pulled in and be like, what is this? Like, but my social media, I was told that my social media team is aware of who I am. So I was like, they're always watching, but at the same time, the content I create is not, I don't feel bad about anything that I create or like I'm in danger.
Yeah, you mentioned at the level of the board, and I think for anyone that's listening, that anyone that catches the podcast, that's something we've been talking about internally here for years, is like a partner who really wants to, I don't sit on any like state boards, but if someone did, we would love to come in and have a meaningful discussion around like, what are the guidelines? Like, how do we protect these folks and their licenses? Because as reporting someone to the board is a huge hassle. Even if it's completely unfounded, they have to investigate the report, and it becomes like a whole thing that it's like, you may be old school, you may not like digital content. It doesn't mean that someone has created some type of a serious violation. Like, reporting someone to the board was intended for like massively egregious medical acts, not making a video online. Now, again, that's the point of guidelines. Like, if you are making a egregiously inappropriate video online, that is an avenue, but it's become, we're a very reactionary society. And so it's become kind of blown out of proportion as to how that goes. So open invitation to anyone who would love to sit down and kind of do guidelines and do things from the top down. Or maybe this will spark something in you to want to, develop a program and from a protective lens. I think it's an area still with a lot of opportunity for growth. And, we've had early conversations with some, but I think there's plenty of room to grow in that space.
Yeah, absolutely. I think, it's tough as a creator to, you want to put out content, but you also want to keep, this is not my full-time job, creating content, and I love what I do, and I don't want to compromise my job. But at the same time, there's stuff that the public needs to know, in my opinion. And I don't think I'll ever stop creating content regardless of what happens. I think, I'm passionate about doing this, and this has always been like a creative hobby for me. So it's not, it's not a job, but that fear of of Big Brother, people watching, my regulatory boards watching, my institution watching, is a little nerve-wracking. So
Jordan,
I want to shift gears a little bit, because what's fun about this podcast is Adam has his HCP hat on, but then I like to bring a little bit of a patient lens and bring it back down to the basics a little bit. So I want to do like kind of some breast cancer 101 and do a little bit of advocacy there. So currently, what are current recommendations for breast cancer screening?
So breast cancer screening, mammograms at 40. And unless you have this is for low risk patients, right? Patients who don't have a genetic history, or first degree relative, so strong genetic history of breast cancer. And there's been a lot of controversy about, self breast exams.
And I was going to ask about that. Is there things you should be looking at home that if you see raise a concern to go to your doctor?
I think women should be doing self breast exams. I know, again, there's a lot of controversy around it, but about the patients I've been seeing, we always ask in the new patients, like, how did you catch, your cancer? Was it a screening mammogram, or was it, did you feel something, right? And for a lot of our older patients, it was a screening mammogram, but we've been seeing younger and younger patients.
Well, that's what I was going to say. And the age is 40. That seems older. I mean, I don't know.
Yeah, it's nuts. And I think these are archaic guidelines, right? We talk about medicine evolving and changing.
Yeah.
And younger patients are being diagnosed with breast cancer, and without family history. Right. And the only way they catch it is like they feel something like, I felt something in the shower, right? Like a lump, and I get it checked out, but they still have to advocate with their PCP. They're like, oh, it's nothing, right? And obviously fighting with insurance companies to get these mammograms approved, when the patient is 25 is very tough.
It's crazy you say about the approval. I was just out with some friends this weekend, and one of the women was sharing a story. She has a family history and talked with her primary, had a script to get a mammogram, and went in, and a radiology tech was like, we're not doing this. It won't be approved. And she's like, no, I have a script. And they're like, you don't need it, honey. You're not old enough. And she was like, she left and of course was very upset. And she was basically saying like, this was such a vulnerable exam and such a potentially life-saving screening exam. And then to have someone, speak to you that way and tell you like, oh, they're not even going to pay for it and you're not eligible. You don't know. It's like, it takes a long time to get these appointments scheduled. It was just such a big setback for her personally that she was like, I left, was upset, and I never went back to that imaging center again. She went somewhere completely different, which makes sense. But it is wild how hard it can be. And as if like a mammogram and the x-ray radiation from that is the problem. That is not the problem. Like you can stand in front of an x-ray machine as long as you're not a x-ray tech. You can stand there all day. It's very low. Take a trip to LA. It's the same as getting on a plane for chest x-ray. So crazy
that
comment,
is insane.
but yeah.
That I'm floored. I like,
I'm boiling over there.
Yeah. I know. I'm like, I would be there like, no, like, let me talk to your supervisor. Like, I'm getting this done, right? And it's peace of mind over everything, right? It's like, if no one wants to get a mammogram, they're extremely uncomfortable, right? Yes. But it's peace of mind. And I think, the controversy on the self breast exams is that, patients get nervous, and, they want screening, and then like, it's exposing people to like unnecessary radiation that they don't need, right? But this is all peace of mind, right? I think, it should be ultimately up to the patient to make that decision, right? And be like, okay, like I have this lump, it's been there, it doesn't feel right. And the patient always knows, like, I always trust the patient over anyone else, right? They know their body, right? Like, who am I to tell you like, oh, that's nothing, right? No. Like, if you're concerned about it, I'm going to address it, because like you came to me as a medical expert, and like, I have to address it, and your body best. So that story is wild to me. I'm still reeling.
Let me know where that was. I'm going there.
Seriously.
No, I say that in the ER though, the same when someone comes in and they're like, I really want this test done. And I have worked with folks in the past who are like, they have that academic medicine, like, you don't need it. Guidelines say this, the data shows this. And I'm like, do you really want to like have their parents write you a letter in 9 months, like at their death for the cancer that they had? And you're like, well, evidence shows statistically it wasn't likely. I'm like, this is a world of free choice. Like, it's free will. If you come in and you feel a certain way, and I explain to you why I don't think that needs to be done. Again, outside of the egregious realm, we've talked about this on the podcast before. I do a lot of shared decision making. I'm like, this is what the evidence says. This is what I think. Here's where I think you should land on the spectrum, but you're your own person. It's not unreasonable to do what you're asking. It's not necessarily the standard, but if you're really concerned and you won't sleep at night, you're here, let's do the test. And I think a lot of people appreciate that. Again, you have to be prudent with it, but I'm not willing personally to take on the moral load of someone coming in and, saying face to face, like, I know something's not right and nobody's listening to me, and to be like, well, the guidelines say I can't do anything, so see you later. Like, doesn't work for me.
In oncology, especially, a lot of patients come in with metastatic cancer because their doctors or, their teams didn't listen to them when they brought it at the beginning, right? And we always say, like, cancer is, you got to catch it early, right?
Yeah.
The earlier you catch it, the higher chance of survival, and you can cure it. And for so many, and it's the majority of it is they're women, right? That get written off with, just this is anxiety, this is, it's all in your head, right? But they know something's wrong, and by the time like someone actually does a test, it's it's cancer and it's everywhere.
Yeah.
And I'm so tired of hearing those stories because that's not right. When like just do the scan, like the patient understands the risks, just do it.
Right.
Insurance is one thing, right? But like as a provider, like,
sure,
please just do it.
Yeah.
In my opinion.
Right there with you.
Gosh.
Before we wrap up, we like to give everyone kind of a free, softball to talk about whatever you'd like, share exciting things that you have coming down the line, anything you'd like to leave with the viewers. So, and the floor is yours.
I guess, we're on the line of patient advocacy, I always tell my patients, don't, and I want to lead this with my patients too. Like, don't be afraid to speak up. You know your body best. And I really want people to know that it's okay to to advocate for yourself and make sure that, you're getting the care that you deserve and to not feel like you need to be written off. And I do the same for, for nurses and for any provider. Like, if you feel like you're being wronged, like, don't be afraid to speak up. I've been quite a fiery advocate, hence my Instagram handle.
I was going to say that's Spitfire.
Yeah. But yeah, no, it's when things are not going, or seem wrong to you, they're probably, you need to trust your gut and trust your intuition. And especially in oncology, if something's wrong, get it checked out. And keep fighting.
Couldn't agree more. And thank you so much for joining us on the podcast. It's an absolute pleasure.
Oh, no, thank you for having me. It was
Thank you for being so honest and vulnerable with us today. We're honored to work with you as well. You're the best.
Absolutely.
It has been a pleasure working with you guys. You guys are an awesome team. And yeah, I'm open, honest, genuine communication is what I pride myself on. So,
well, we appreciate you. Thank you again for joining us, and thanks to everyone who listened in.
Bye, guys. Thanks.